Hello, my name is Corbin Hawk,
and I am a doctor and nursing practice student at the University of Missouri, Kansas City. With a background in critical care, I have discovered the importance of end-of-life planning and truly believe that this should start in the primary care setting, not the hospital. As important as these documents are to guide your loved ones on end-of-life scenarios, only about 1/3 of Americans have an advance directive completed. Therefore, I decided to make a video to help improve the understanding of advanced care planning. This video, titled Prep for the Next Step, is designed to equip you with the necessary knowledge to make informed decisions regarding advanced care planning. So what is advanced care planning? You may have heard of documents such as an advance directive or a power of attorney. Advanced care planning is the process of planning for your future medical care. It is important that everyone participate in this process while they are healthy, as unexpected medical problems can arise, such as a car crash, a heart attack, or even COVID-19. The 5 steps to the advanced care planning process can be remembered by ReLive. The first step is reflecting on what a good quality of life means to you, then learning about your options, implementing your wishes into documents, voicing these wishes to your family members, and engaging with your primary care provider. So let's dive right into the first step of reflection. It is important to first reflect on what a good quality of life means to you. And keep in mind, this may change throughout your life. Does a good quality of life mean maintaining consciousness, eating or drinking, maybe breathing on your own, or being pain-free and maintaining dignity? Second, we must reflect on what a good power of attorney for healthcare choices would be for you. This is sometimes called a surrogate decision maker or a patient advocate. Usually these are spouses, family, or friends, someone who lives nearby, someone who can clearly communicate, feels fit for the role, and preferably someone with some type of medical knowledge. This is someone that will speak up for you in case you can't. The second step is to learn your options. Did you know that brain death and cardiac death are different? It is important to make it clear what you would want in the event of brain death, defined as no longer having brain functions to breathe or move on your own. You may want to be kept alive on a breathing machine indefinitely, or you may opt to donate your organs to someone in need. The topics of artificial food and nutrition, CPR, dialysis, and inserting a breathing tube are common, but let's make sure you fully understand what you are signing up for. CPR is short for cardiopulmonary resuscitation, cardio meaning heart and pulmonary meaning lungs. There are 2 main options. One option is to be a full code, meaning you would want everything done to keep you alive. CPR would be performed in the event your heart were to stop, which often breaks your ribs. A breathing tube will also be placed to support your airway during chest compressions. Additionally, life-saving medications will be given to stimulate your heart. There are 2 rhythms that require shock therapy. If your heart were to go into these rhythms, you would be shocked. The second option is to be a do not resuscitate, or DNR. This would mean that CPR would not be performed and you would not be shocked. Instead, death would occur naturally without any intervention. When deciding if you want CPR performed, it is important to know what comes afterward. About 77% of men and 85% of women have rib fractures after CPR is performed. If CPR continues for 4 minutes, organ damage is probable. And when CPR continues for 10 minutes, organ damage is often irreversible, particularly brain damage, heart failure, kidney failure, and liver failure. Now that we've talked about CPR, let's talk about intubation with mechanical ventilation, also known as a breathing tube. There are a few main options. First, you may be a do not intubate, or DNI, meaning a breathing tube will not be placed no matter the circumstance. Second, you can be a full code and DNI. This means that compressions and shocks will be performed, but no breathing tube will be placed. It is important to note that if your heart stops, a breathing tube is essential for survival to support your airway. Lastly, you may be a DNR/DNI, meaning no compressions or shocks will be performed and a breathing tube will not be placed. There are different types of breathing tubes. However, the concept is the same. The breathing tube is hooked up to a machine to help you breathe. The endotracheal tube is inserted through the mouth, between the vocal cords, and ends right above where the lungs branch off. A balloon is inflated at the end of the tube to keep it in place. This type of airway is temporary and is used for about 10 days. A tracheostomy, or trach, is surgically placed by cutting a hole in the neck directly into the airway. It is a more permanent airway, however, it can be removed when it is no longer needed. The next topic is artificial hydration and nutrition. Artificial hydration involves administering fluids through your vein, while artificial nutrition involves placing a tube through your nose or mouth to your stomach to start tube feeding, which looks like brown liquid in a bag that is given continuously. If tube feeding is not an option, total parenteral nutrition, or TPN, is used as a last resort and provides nutrients through a vein. TPN is so irritating to the vein that a larger catheter must be placed, called a central line. Artificial hydration and nutrition may be considered if you are unable to swallow properly or if you are on a ventilator for more than 2 to 3 days. If longer-term nutrition is needed for more than 30 days, a more permanent feeding tube is surgically placed. This is called a PEG tube. This does not always have to be permanent, and oftentimes a trach and a PEG are placed around the same time. The next topic is dialysis. Your kidneys are your body's filter. They help remove extra fluid, waste products, and drugs from your body. If your kidneys were to fail and you would need dialysis, a dialysis catheter would be placed to remove some of your blood, filter it, and return it back to your body. Dialysis takes a lot of time and may affect your quality of life. This is usually required 3 times a week for 2 to 3 hours per session. Dialysis doesn't always have to be permanent. However, opting out of dialysis when the kidneys have failed can be fatal due to electrolytes, waste products, and extra fluid building up in your body. Other life-prolonging interventions to think about include chemotherapy and radiation for cancer treatment, surgery and invasive procedures, and antibiotics. Organ donation at the end of your life is an option as long as your organs are healthy. The third step is to implement these choices into a legal document. This starts with talking to your healthcare provider, family, and close friends about your choices. Paperwork is then completed. An advance directive document has 2 forms. Part 1 is the durable power of attorney for healthcare choices, and Part 2 is the health choices directive. Part 1 is the durable power of attorney for healthcare choices. In this document, you will name a person to make healthcare decisions in the event that you are not able to. It is important to remember that you are the one making medical decisions until a medical provider has deemed that you are incapacitated. Incapacitated means that you are unable to physically or mentally make informed, rational decisions and effectively communicate. This may be from confusion due to an acute illness or drugs or being on the ventilator, in which case an appointed representative will make medical decisions for you. In most states, if you do not have this document filled out, your spouse is automatically the decision maker, followed by your parents, children, and siblings. In order for Part 1 of this document to be valid, it must be signed and dated by a notary. Part 2 is the Health Choices Directive. In this document, you state your wishes regarding specific treatments that you do or do not want in the event you cannot make decisions for yourself. This also includes choices regarding organ donation. You may also add special requests such as a preferred place to die or any special burial requests. In the official document, you will initial next to any of the following interventions that you do not want. Topics include artificially supplied nutrition and hydration, surgery or other invasive procedures, antibiotics, mechanical ventilator or respirator, heart-lung resuscitation or CPR, dialysis, radiation or chemotherapy, and other procedures specified. You must sign and date your document in the presence of 2 witnesses. One of these witnesses can be a notary. The other witnesses cannot be anyone related to you by blood, marriage, or adoption, the person chosen in Part 1, any beneficiaries, no healthcare workers, and no one that is responsible for your healthcare expenses. The 4th step is to voice your wishes. This step is the most important but least completed step. This involves sharing your documents with your healthcare provider, family, and close friends. It also involves giving each of them a copy of the directive. It is important to also bring a copy with you when you go to a hospital. The final step is to stay engaged in future medical planning. It is important to stay up to date on your documents by revisiting them according to the 6 Ds. You should revisit them every decade, with a death of a loved one, divorce, a new diagnosis, decline in function, or change in domicile or person who's living with you.
Here are some references used in this video. I would also like to take a moment to thank my project mentor, Heather Lemke, and my faculty mentor, Dr. Brian Galasio, for making this project possible. Please advance to the next page where you will complete the final survey.
Thank you so much for participating in this project. I hope you found the information useful. I've provided a direct link to advanced directive documents if you would like to fill them out and start this process. I have also included a link to help you find a notary near you.